Hello and welcome to Healthcare Excellence Canada's webinar series on promising practices to enable aging in place. I'm Maëlle Marchand, I'm going to be your host today. And this is the third webinar in a three-part webinar series where each features two promising practices in Canada. Through our Enabling Aging in Place collaborative, HEC has had the privilege of learning about so many great programs and initiatives to support aging in place. And we know that folks across the country are also keen to learn about what others are doing as well. Next slide, please. So today's session is bilingual. We're pleased to offer simultaneous interpretation by Boost Events for the session. So please choose the language you wish to listen to from the interpretation menu, and you can see that at the bottom of your screen. Or if you're comfortable in both languages or just prefer to hear whichever language is being spoken, just simply leave the interpretation set to off. Donc aujourd'hui, nous passerons d'une langue à l'autre durant le webinaire, donc l'interprétation est disponible. Veuillez choisir la langue que vous souhaitez écouter aujourd'hui dans le menu d'interprétation. Si vous êtes à l'aise dans les deux langues, vous souhaitez entendre la langue parlée, vous n'avez rien à faire, simplement laissez.
Today we have simultaneous interpretation. If you're comfortable with the two languages, you can simply keep interpretation.
Reach out to tech support using the chat feature. And as always, you're always invited to share your questions and any comments that you might have at any point in the chat box in either English or French. And please respond to each other's comments as well, or answer questions in the chat as you wish, and we'll share as many of your questions as we can with our speakers during the question and answer period at the end of the webinar. And if we don't have enough time to answer every question, just know that we will include responses to any unanswered questions in a follow-up email after the webinar. And finally, just a last reminder that the session is being recorded. And of course, you'll be able to have a link to access the recording in the next week or so after the webinar, where you can review it and share with colleagues who might have missed it. Next slide, please. So as we know, enabling aging in place is place-based work. The environments and the spaces that we inhabit, they matter. And the people that we have the privilege of sharing these spaces with matter equally. So as a settler on Turtle Island myself, I acknowledge my privilege and our collective privilege to come together today as a community to be able to virtually gather from lands that have been inhabited by Indigenous peoples since the beginning. Our offices at HEC, from which we're broadcasting the webinar today, are in Ottawa, which is the traditional and unceded territory of the Anishinaabe Algonquin Nation. And we recognize not only their historic connection to this land and the place, but also more generally and more broadly, Indigenous peoples' deep knowledge on the land and land stewardship, sacred medicines and teachings, and community well-being and empowerment, from which we continue to learn from our journey to truth and reconciliation at HEC. And we continue to also dive deeper in our understanding as we take on more of these place-based initiatives, such as enabling aging in place. So I'd now like to invite all of you to say hello in the chat, introduce yourselves so we can all have the privilege of knowing who's in the room today. And please also share the name of ancestral lands from which you're joining our virtual community from. Next slide, please. So this may go without saying, but at HEC, we are really proud to be supporting communities and initiatives that enable aging in place. The work we are supporting all align with the key principles that we've identified as enablers of aging in place, which you can see on this slide for yourselves. And for more details about these principles and how we've identified them, you can review the video from webinar 1 in the series, which you can find on our website, and it'll also be posted in the chat shortly. And also these principles are described in our promising practices case studies, which are available also on the website and soon to be posted in the chat as well. Next slide, please. So without further ado, I'm pleased to host representatives from two promising practices today that exemplify these program principles. So we have from the Circle of Connections program, Kim Larson and Amanda Panisiak. So Amanda has always been passionate about rural nursing and started with Big Country Primary Care Network in 2015. She was drawn to working with older adults in her community and enjoys building strong connections with patients and their families. Outside of work, She stays very busy helping her husband on their cattle ranch and running after two kiddos, daughter Natalie, who's 10, and son Austin, who is 8. So she loves spending her free time doing crafts and taking care of all kinds of little critters on their farm. And she's accompanied by Kim, who has spent her career in the field of recreation therapy, first in long-term care settings for 17 years, and more recently in community-based settings. She began working with Big Country Primary Care Network in January 2023 as a community liaison coordinator. She really enjoys working with seniors living in the community with the goal of helping them live as independently as they want for as long as possible. And she has a passion for facilitating group programs that enhance quality of life and forge meaningful connections. And so similar to Amanda, Kim and her husband run a mixed farm. So when she is not working, you can find her outside on the farm working with the cattle or in the combine or seeder. And she has 3 children, Kirby, Kylie, and Riley, who also keep her very busy. And speaking on compassionate communities, we have Cynthia Lapointe and Émilie Lessard. Donc, parmi nous aujourd'hui est Cynthia, qui a plus de 20 ans d'expérience dans le domaine du développement communautaire.
With us also Cynthia, who has 20 years of experience in the community development area. She offers palliative care to the community. She has experience and knowledge and is passionate with working with the elder community. She is She has worked a lot about public health care, different services. She works also on palliative care and grief. She is right now in charge of participatory evaluation for the patients, but also communities.
We'll go over to the next slide and pass things over to Kim and Amanda. So thank you for being with us today, and I'll invite you to turn on your cameras.
Okay. Good morning. Well, my name is Amanda, and I'll put you to the next slide. Perfect. I wanted to start by introducing our community coalition. They are the force and drive behind our program. This group was started and created in 2019. We are a small but mighty team of like-minded people. We are passionate and determined in our work with seniors, and we are really willing to stretch into the gray zone. So first you see Karen. She is our FCSS, which is Family and Community Support Services connection through the town of Drumheller. Myself and Kim through the Primary Care Network, and Liza Trohan, who's our Seniors Outreach Nurse through Alberta Health Services. Next slide, please. So about Drumheller and our valley, it's taken us some time to find the right description for our rural setting. We started by describing our area as rural, but that was misleading. Rural means outside an urban hub. So here in Alberta, we have, communities like Airdrie and Strathmore, who are just outside of Calgary. And another example is Innisfil, that sits just outside of Red Deer. They can still piggyback on resources and services from those larger urban centers. But remote better describes the limitations in accessing services and supports in our community. Drumheller is located about 2 hours east of our nearest urban center. Tourism draws large crowds and financial investment to our community, but also pulls resources and focus from the needs of those who call the valley home. Our coalition struggles to be heard by town council for them to buy into our programs and provide sustainable support. So even though we can show the number of seniors choosing the Drumheller Valley to retire and age in place is growing, we are far behind in planning for and supporting their needs. And why do people choose to come to Drumheller? For some of us, it's home, but others choose because houses are affordable, it's a quieter place, and it's really easy to navigate. Next slide, please. So this is fun, how it all got started. I've been a part of our program from the beginning, and truly that first face was me. Our work on the Circle of Connection Day program began a few years ago. A young and eager primary care nurse was receiving frequent referrals from physicians and calls from FCSS for seniors' care. Someone was concerned about their memory, someone was worried about dementia, or someone maybe had a new diagnosis of dementia. In meeting with patients and families, it became clear that there were many gaps in services and supports here in our community. We lacked knowledge at a clinic and community level. We lacked social programs that fit higher needs, and home care did not have the capacity to offer or sustain respite care. So I could meet with families, I could identify their needs, and then what? I had nothing to offer them to help keep their loved one at home. Sorry, I'd say, I don't have what you need. So I got to work. I made some noise here in our community. I made some really memorable presentations to get people's attention. And I called some friends. And we got to work prioritizing what activity would get us the most bang for our buck. What would check off multiple boxes of need. And we took a grassroots approach with the support of a provincial project team to see what resources we could pool together and how we could make a difference. We landed on a joint funded model, knowing that one group alone could not provide all the funds or resources for our program. And our program has evolved, adapting to many challenges and changes, with support and then lack of support through Alberta Health Services, the COVID pandemic, pilot projects and staff who we had and lost, to finally hitting a stable and sustainable structure in 2023. Through lobbying with the Primary Care Network, we were able to hire Kim, our Community Liaison Coordinator, to oversee our Circle of Connection program, among the many wonderful other things she does in her day.
Okay, next slide, please. So a little bit about our program. So the Circle of Connection program is held every Tuesday from 1:30 to 3:30, generally at our public library, but we do some outings in the community as well. The goal of this program is twofold. So the first is to provide a safe and welcoming environment for people living with dementia or those at high risk of social isolation living in the community to come and engage in social interaction, promote physical well-being, and increase or maintain cognitive function. The second goal is to provide an opportunity for consistent respite to caregivers in our community. So the morning of, I always make reminder calls to participants to remind and invite them to the program. And I also line up transportation for those who need it. Participants comment, "I look forward to your phone call every Tuesday morning," or "You're the only phone call I get all week." We have found these calls really do help motivate people to attend each week. One fellow often tells me, "I know when it's Tuesday. The spirit is willing, but the body is weak. I wrestle if I'm going to go attend or not. Then you call, and that sways me. I always attend because you call." For some of our participants, this program is the only time they leave their home all week. For most of our caregivers, it's the only respite they have all week as well. When we're at the library, programs are planned around seasonal themes and special events. Topics such as Groundhog Day, Cinco de Mayo, or Earth Day guide discussions and keep participants engaged. We've tried a variety of activities. Amanda loves crafts, but we found out the group doesn't. Physical activities are also not their favorite, but we do incorporate this into each week as we know it's integral to maintaining independent function. The part most participants look forward to the most is the coffee social that rounds out the afternoon. We supply coffee, tea, and treats each week and gather around the table for a visit. Participants enjoy the chance to talk about the day's events and what might be coming up next week. Our first program started with 4 participants, and it's been growing ever since. Amanda does screening to ensure we're meeting our target population, and we currently have 12 to 15 participants each week. We didn't want to set a capacity limit. However, we've determined we're at program capacity. When working with people living with dementia or those who require support to be successful in a group setting, we need to keep our numbers manageable to make sure we're able to keep everyone engaged and the outcomes positive every week. We currently have 7 people on a wait list for the program. One thing that has been key to the success of our program is the effort made to remove any and all barriers that may keep people from attending. Transportation is arranged and paid for by grant funding. There's no fee to attend, and supplies are purchased with grant funding, and any entrance fees for outings are also covered. We really strive to use a person-centered approach in our group. The goal is for each participant to feel valued, heard, and appreciated for their uniqueness throughout the program. In doing so, we've built a solid rapport with the participants. They trust us to provide a positive experience each week. We've watched a group of strangers become best friends, almost like a family. And for some of our participants, this group is all they have, their social and support network. They watch for each other each week and ask if someone's missing. They may not remember names, but they remember how this group makes them feel. They matter here, and that is something special. Next slide, please. Community integration has also been a real focus of our program. We really want our participants to feel like they belong in their community and they feel welcome in the spaces we visit. Dementia and the process of aging itself can cause people to isolate in their homes. They're unsure how to navigate what once were familiar tasks. We've set up monthly outings into the community to visit venues that participants would not likely visit on their own. Again, work is done behind the scenes to make sure it's barrier-free and a positive experience. Participants are willing to attend because they know that I'll be there to meet them. They trust that we'll provide a positive experience where they feel supported. We have visited places such as Barney's Adventure Park, where participants were treated to pig races, a petting zoo, and gator rides through an interactive dinosaur trail, as well as the Valley Learning Garden, where we watched the raised beds go from worked up dirt in the spring to flourishing vegetables in the fall that participants were able to take home. The library has become a place where participants feel welcome and supported. Some have even started to visit the library on their own, aside from the Tuesday afternoon group. The staff there recognize our participants and are able to redirect them if they go to the library on the wrong day. Next slide, please. The secret sauce. So why has this program been so successful? One of the secrets to our success has been our volunteers. To run a successful program with the objectives we have, you need the support to do it. Those who are willing to jump on board and who fully believe in what you're doing. These gals bring all the fun extras, a helping hand, the snacks, the smiles, the coaching, the coffee making, all the extra things that make the program run smooth each week. We've been very purposeful in who we have recruited to volunteer with us. They are all retired from the healthcare field with experiences that give them a foundation for caring. They're invested in this program and they plan their calendar around it. We could not be more thankful for the ladies that join us each week who buy in and go above and beyond to make the program meaningful for our participants. We've also been fortunate to have some work experience join us from the local high school. The participants were so excited to have young people there who wanted to spend time with them. I'm not sure what that means for Amanda and I, but not as young as high school students. The intergenerational flair was mutually beneficial for both the students and our participants. Next slide, please.
So the impact, where do we begin? It's so hard to share the warmth that you feel when you walk into the room where our group is. When we first are talking to new participants to our group and inviting them to our program, we hear things like, I don't fit in, I don't have any friends left, and I can't do things anymore. Comments that are filled with doubt, hesitation, and the fear of judgment. So getting them that first day is really tough, getting them there. You know, time with the patients, time with the families, and really coaching them through the benefits of our program. It's a big time commitment, but it's well worth it.
We've worked really hard to tailor the program to the needs of the participants. Sometimes this takes some trial and error and to figure out what makes them tick. We found that consistency is important. A familiar face and a familiar space can go a long way to build that initial rapport. We had one participant who lived with dementia in his home that was reluctant to leave his home each week. It was a bit of a fight for his family to get him out the door. However, he would see me waiting for him at the door to the library with a smile and an outstretched hand, and he would never refuse. We had another participant who was born and raised in England, and he would always choose to have tea during our social time. It didn't seem to matter how we prepared the tea, he was always disgusted with it. You call this tea, he would say with a scrunched up nose, until we finally realized it wasn't the tea at all. It was the cup we were serving it in. We switched to using a porcelain china cup and we were set. Never had an issue again. We've built not only a community, but a network that truly cares. They have purpose, they have friends, they can try things they never imagined. And we keep pushing them to do just that, to trust us, to take them on their next adventure. We do have a short video. I'm not sure if we have time to show it or if it will just go in the chat.
Let's go ahead and share the video.
Okay, it's just 2 minutes. It's not long.
Often as people age, you know, it's most common for them to sit in front of the TV. So our group submitted the application for the ABCD grant last year to provide or to secure funding for added programs in our community. And the program we chose was the Memory Cafe. A program like this allows us to provide services that aren't offered, you know, in any proximity to Drumheller.
It's more mobile, very engaged with various community vendors and community event spaces, and they just travel to whether it be an adventure park, to a movie theater, and gosh, they've been to so many places.
I haven't read the objectives for this program, but I suspect one of the objectives is to keep us old people out of the hospital, keep us active, and I think it really does that.
We are taking our participants to Barney's Adventure Park, to the theater. We have a planned outing to the Tyrrell Museum, and it allows them to experience something very unique, gives them something certainly exciting to talk about with friends and family. They can still laugh, they can still build friendships, and together with their loved one, they can try something new. We have really seen friendships blossom.
I have dementia, so it's kind of nice to be able to talk to other people that have problems too. You know, hear their comments and what's helping them and what you can kind of learn from somebody else if you have problems.
I would think the relationship with the people that are running the program is one of the top. They just are good people that seem to care. I am surprised at sometimes the kind of service they offer me. It's just much beyond what I thought it would be. And I guess I can't stress the kindness.
So we just feel like that video really kind of gives a good feel for what part of our program goal is. It also speaks a little bit to funding. So funding is always a concern as far as the transportation, the entry fees, the supplies. And so that video kind of captures what drives us to keep doing those grant applications, to keep taking the time and effort required to try to keep finding funding to continue the program.
Thank you, Kim and Amanda, for your very heartfelt presentation and for your generosity in not only sharing this wonderful video and your photos, but also the secret sauce of the Circle of Connections program. So thank you. We're going to transition over to our second presentation, but we'll see you again near the end for our question and answer period. And so we'll now hear from Emily and Cynthia on compassionate communities. And a reminder to please ensure that you have selected the language you wish to listen to from the interpretation menu at the bottom of your screen. Though the presentation will be in English, happy for folks to answer questions in French as well. So, Émilie et Cynthia, si vous voulez bien nous joindre à l'écran, comme je peux voir, et allumer vos micros.
Emily and Cynthia, could you please switch on your cameras? So the floor is yours now.
Merci Maëlle pour l'introduction. Thank you, Kim. Kim and Amanda, we can rely with your project in compassionate communities. So maybe we can go to the next slide. So we are here today with me and Cynthia to present you some of the result of our Compassionate Communities project. So we can go to the next slide. So just to give you a little bit of context before we jump in, Compassionate Community Montreal start as a participatory research, which aim to co-design, implement, and evaluate 2 compassionate communities. So you can see right here on your screen, Centre-Sud and West Island. So today we're going to talk to you about West Island community. So it starts with a funding from the Gilles Louis Lévesque Foundation, which enables a collaboration between Montreal Institute for Palliative Care and the Canada Research Chair in partnerships with patients in communities. So next slide, please. So it is a huge work. So it takes a huge team also to in order to start and develop a compassionate communities. I just want to direct your attention on the community development team. So here today, I'm very pleased to be here with Cynthia, which Cynthia is the community development for West Island. But I want to je vais le dire en français, je vais souligner le travail de Lise Jean et Serge Dano, which done the work for the Centre-Sud neighborhood. So next slide, please. So before we jump into compassionate communities, just want to take some couple words to say that compassionate communities is one of the best known example of new public health approaches to death and dying. And here we have Alan Keller, who started public health palliative care and the compassionate communities movement, who simply reminds us that dying is a social phenomena, it's not a medical problem. So human connection and community support are essential to enjoying life until the very end. So next slide, please. So as you can see, they have multiple layers of theoretical foundation. We're not here today to talk about that. What I want you to keep in mind is that the compassionate communities movement, as well as the public health approaches to death and dying, just proposed a social model of palliative and end-of-life care that complement the more traditional biomedical model. So next slide, please. Cynthia?
Hi, everybody, and thank you for having us here today. It's a pleasure. So what is a compassionate community and how is it developed? So a compassionate community is really exactly how it sounds. It's a group of people caring for people within their community who are in need. A compassionate community are people who are committed to improving the experiences of those who are isolated and those who might be dealing with a chronic or end-of-life illness, those who are caregiving, dying, and grieving. A compassionate community takes an active role in caring for people affected by these experiences. It connects people to supports, it raises awareness about end-of-life issues, and it builds supportive networks around them. But how do we develop a compassionate community? Well, for sure, I think one of the most important things to realize is that a compassionate community takes time to develop. You really have to get to know the community, the region, or area that you want to create a compassionate community. And you really have to know the geographics, the demographics of that area, and to know who it is that you're going to be dealing with. That's really important. And when you're making those connections with other community resources, you want to make sure that you're understanding their needs as well as them understanding your needs. That's really important in creating those links to start developing your compassionate community where organizations and people can work together to support those in need. Next slide, please.
Yeah, I'm going to through that slide. So you may be wondering how we develop. So when we started the research project, the first thing we have done is a scoping review to know how compassionate communities were implemented and evaluated around the world. So what we found is that the compassionate community model is usually based on community development approaches. But in the reality, there are few compassionate community projects that are truly led by communities. So here we just put some professionally led is one approach, community led is another. You may be more familiar with top-down and bottom-up approach. We prefer to use those terms. So they don't have an approach superiors to one another. It's the key message here is simply take the approach that most fitted the local context. So next slide. So as Cynthia just started to explain, it is very important to start with a local context and needs assessment. So here we have West Island territory. We can describe the community as a large suburban territory. This is the West Island of Montreal. So you don't see the whole island of Montreal. So it's a large territory. They have over 100,000 population living there, and 44% are over 65 years old. So it's an aging population over there. And the last important characteristic is that it is an English-speaking community. So it's a minority language because it's surrounded by French. So when we look at the needs in the West Island, of course, we find that the needs are centered around seniors and family caregivers. They goes along with dying trajectories of chronic and degenerative diseases. They have a lot of social isolation issues, needs for home support, and last, needs to increase that literacy. So next slide, please.
So when we are looking at developing a compassionate community, we want to be sure to look at community partners, who they would be and how they would help to support this model. So you want to get citizens involved, volunteers, volunteer bureau of the region, places of worship, libraries, senior clubs, senior centers, nonprofit organizations that offer different services, healthcare providers, whoever those healthcare providers are in your area, clinics. Also important to include municipalities and the representatives of those municipalities, such as the mayors. So those are the community partners you want to look at to start creating this compassionate community. And then to reach the population, as Emily was saying, of course, in West Island, we have a lot of seniors. So we want to reach those seniors at home who may be suffering from a chronic or end-of-life illness or in transition of palliative care, especially family caregivers who are feeling burnt out and overwhelmed. We also want to look at seniors who are victims of fraud, because as we all know, it's a major problem in our country and the world. So we want to connect all these people, high school students as well. Very important, that intergenerational contact. Next slide, please. So when we look at a compassionate community model, we have a variety of programs that we offer within this compassionate community initiative. And one of them is the intergenerational project. And of course, as our other presenters were saying, it's very important that the youth and the seniors connect. So this intergenerational project that we have, it is called the Conversation Collage, and we offer it in residences, and we connect the residences with the schools, the high schools, so that those two generations can connect. They can it offers a bridge to that generation. It also offers seniors a chance to break isolation, to feel empowered, to teach as well as to learn, which I think is really important. And how we do that is we do it through this Conversation Collage, which is really an art program offered to the pairing up with the seniors and the students by creating a visual display of memories of their life. And the students and seniors work together to create this visual display. And while they're working together, they're creating all those connections and that great communication. Next slide, please. This is another one of our compassionate community programs in our community. So this program is called SAFE, which stands for Seniors Against Fraud to Educate. And if you're wondering, for those of you who may not know, SPVM in Quebec is our police force. So that's the police force. And we were very lucky to be to have the opportunity to work with one of our local police stations in this new program. So unlike other police programs that are offered everywhere to prevent fraud, and to teach people and educate people the importance of, how to recognize when fraud is happening, there's not that much that offers after fraud has happened, once they've been victims of fraud, and the feelings that creates, and the stigmas that creates. So the police, this local police force and ourselves partnered up to create this program. And what we do is we invite senior victims of fraud to come to this program where they have a safe place to talk, to share their experiences, and really to feel empowered that they're not alone, and they shouldn't feel ashamed, because fraud can happen to anybody. And we did this pilot project. It was very successful. And it's great that we're hoping that the police will take it and offer it, of course, in larger areas of Montreal, in the city of Montreal. That's the goal. Next slide, please. So, of course, when we're looking at the fraud program, the Safe Fraud program, we know that when people are frauded, seniors especially, this can really either affect isolation, or if they're already isolated, make it even worse. So this is to break that isolation, to reduce those feelings of shame and guilt, to empower those seniors, and of course, to especially promote social opportunities for the seniors involved, so that they can not only share their story, but help other seniors who may be going through the same thing and scared to talk about it, and help them to deal with it as well. And I want to share with you a story about one of our participants. She was an 88-year-old senior who was frauded. She comes from a big family, a close family. She really was unable to talk about this fraud to anyone, not even to her closest family at all. She was so ashamed and felt so guilty about this. How could this happen to her? She was afraid to answer her phone. She was afraid to answer the door. She didn't want to use her computer because she was afraid she would be frauded again. But she did actually find the courage to go to the police and report the fraud. And that was the key, because then one of the police officers invited her to this program, this SAFE program. And when she came and she had that experience with other seniors, she told us that after she was able to share her story, to get that support and to realize that she is not alone and that there's other people who've gone through this experience, it changed her life. And when she left, she says, now I know I'm going home feeling more secure and also knowing that I'm not alone. Next slide, please. This next program that we offer under the Compassionate Community model is NavCare. And NavCare stands for Navigation and Care. And what it does, it really is training, because there is a very detailed training module that we use to train volunteers in the NavCare program so that they feel ready and prepared to be matched with someone in the community who might be dealing with a chronic or end-of-life illness, might be very isolated, has mobility issues, might be grieving or have just recently lost someone in their life. And of course, those that are lonely. So all kinds of issues that somebody could be going through. These volunteers are paired with them to become their own NavCare volunteer, and they visit them in their home once a week. They're a companion to them, they're a support to them, and a confidant. But most importantly, their role is to navigate, and we train them to navigate so that they can find the exact unique resources within the community that this client might need in order to improve their quality of life. And that's really what it's all about. And we're very happy to say that over the last 2 years, since this program has started, we have trained over 20 volunteers, and we have brought in over 30 clients. And we're getting so many referrals, it's just blowing up, which is great. But it's really important, again, to reiterate that our partners in the community make this happen. So we are connected with our municipalities, with our CLSCs, which in Quebec means our healthcare system clinics, and the CS, which is our healthcare system, the SPVM, our police system, and many other organizations and community centers and services that we're connected with who refer the people to this program, and to keep it going and to make sure that we're getting that information, that we're able to reach these people who are vulnerable and who are in need. Next slide, please.
Yes, the last slide to just say thank you for inviting us. It was a pleasure to share with you, and we are eager to take your question and answer. I'm sure you have plenty of question.
And thank you very much, everybody. Great to be here.
Merci, Émilie et Cynthia, pour cette présentation qui était...
Thank you so much, Emily and Cynthia, for this presentation. That was very thorough and interesting.
To join us again so we can open up our question and answer period. So Kim and Amanda, if you just want to turn on your cameras and join us, that would be great. And in the meantime, of course, I'll invite you all to ask your questions or share your comments in the chat so we can bring them up to our speakers. Again, it can be in English or in French. Donc, maybe I'll kick us off with the first question. And the first one will be directed to Émilie and Cynthia. Donc, pour une première question, je vous cède la parole en premier.
So I'll give the floor first to Emily and then Cynthia. You gave us the difference between community-led programs and professional-led programs. My question is, what are the key elements or the variables to take into account to engage with the communities, especially with the elders, when we are developing a compassionate community?
The first thing is really to assess the community. So is the community readiness? So some community have a more collaborative mode of action. Others is different. If we think about remote area, people are not isolated, but is harder to make some link to engage the people. So what is important to do is be strategic, look at your community, and sometimes you can try to engage the community members, and it is not working as well as you want to do. So here you take more top-down approach, and then you, like the NavCare is one of a top-down program example, was being developed. I think it was in Alberta, or yes, it was in Alberta
In
for
British
remote
Columbia. British
and
Columbia, yeah.
Yeah, so we take it because we need it. We need to have some program or whatever, and then after community are more engaged, so we can do some co-development, co-design of programs and things like that. So the most important things, assess the community readiness and some of social demographics and things like that, and it can align you to choose between the two approaches. And like I said, you can also take the both approaches, a combination of both, whatever works. Yeah, we have to be pragmatic.
And I think also it's getting people excited about the idea of joining, you know, certain programs that they might be interested in, and really educating the community. So going out there, doing presentations about compassionate communities, talking about it, the importance of it. And again, you know, if you want to engage your community, you have to engage your partners. And when you engage your partners, that means really, and I'm emphasizing this, you want to know what they're doing too. So it's when you're trying to develop, you want their help, but you need to make sure that you know what their needs are and their struggles are, so that it's a shared situation where you're saying, hey, maybe we can help you do this and you can help us do that. And we're going to reach so many more people. And I have to say, with NavCare and Emily with the SPBM, the police, the SAFE program, you know, a lot of our reaching our community, people in need, is through organizations. We get referrals. They call us. They say, hey, I have this senior lady who's alone. Oh, I have this gentleman who's losing his memory. And that's where it comes from. So those connections are key.
Thank you. And Kim and Amanda, lots of nodding heads. So I think that it resonates for them as well. There are some questions coming in through the chat, so I'll pass it over to you, Kim and Amanda. Question from Sydney Taylor. So knowing how important addressing social isolation is, do you have any plans for scaling or expanding your program?
Well, we'd love to. So right now we're just actually trying to figure that out. So my position with primary care is only a 0.5, and I cover 3 communities with that FTE. Amanda's a 0.8 in Drumheller, but has a lot of responsibilities outside of this program. So there's definitely the need to expand the program. It's just how do we find that funding in order to do that? I think the biggest piece of that is making it consistent. So, you know, how do we supply something or propose something that is going to be consistent for people week after week, so that those caregivers do have that time that they can kind of really plan for, and that those participants do have that consistent interaction and schedule. I don't know, do you have anything?
No, that's right.
Thank you. We have another question in the chat from Isha, and it's a multi-part question, and it's for all presenters. So maybe we'll break it down into 2 parts, and I'll throw the ball back to you, Kim and Amanda, maybe starting with you, Amanda, if you're comfortable. So the first part of the question was, to what extent do diverse or minority communities access and participate in your specific programs? And if they do you have an idea of approximately the percentage of those participating who would fall under diverse and minority communities in your program?
Like, for us, we don't have a large percentage, or, you know, we don't have a huge draw for anyone we'd put into kind of that minorities community. I think the program size is a huge factor in that. So having you know, a small group that you can integrate, you know, someone new into the program is really helpful. And so, yeah, our outreach for that, you know, our demographics are pretty similar in our outlying communities. So I can't say that we have a big percentage that kind of relates.
And that also might have to do with the remote setting that you're based in. And so curious to ask Emilie and Cynthia your thoughts on this too, being in Montreal, maybe you have a different makeup of communities. So again, the question being, to what extent do these diverse or minority communities access and participate in your specific programs?
Well, excuse me. Yes, for sure. We have a very diverse city. I'm proud to say. We are, of course, French first, English, and then we have many other cultures that live in the city as well, speak other languages. So what I would say to that is, demographically, I would have to look at Emily if she would know what the percentage is. I can tell you that in West Island, we are majority English speaking, but not necessarily first language English. And most of our community does speak some French, of course, as Quebecers. We also have certain pockets that are very multicultural. So we try very hard with our volunteers to encourage volunteers who speak other languages. So any language you speak is a very big bonus to reach out to those who might feel so much more comfortable speaking in their own language, especially if it's not English or French, because they may not have heard it for a long time. And to have somebody to come in and be able to speak Polish to them, or German, or Arabic, or Spanish, it's such a comfort. So that's really important to us. But of course, looking at, and this is something that I think we're all growing into as community development. I mean, we're seeing more and more, of this culture, diversity and inclusion, and we need to step up as well and do our best to find those volunteers and figure out how we can help people with other culture and language needs. So.
Yeah, and I would add that, yes, in the West Island is an English-speaking minority, so we act on that, but that's true that concerning all other kind of diversity, it was maybe a little bit harder in the West Island, but in the Centre Sud neighborhood, which is downtown, we have, it's all it is the LGBTQ plus communities, is homelessness, is addiction, mental health, refugees. We have a couple of other programs, but they just not happens to be in the West Island, because of the characteristic, like I told you a little bit earlier. But compassionate communities or public health approach to death and dying is all about equity, diversity, and inclusion. So how we can develop services to, and people living in remote area is kind of minority too. So I think it's just do a scan, an environmental scan of your community, and look who is the minority, who is what population is from the diversity, and try to engage with them.
Thank you. And just answering the second part of the question before we move on to our next question, and I'll ask this just more broadly to everyone, for if there has been issues around, accessing diverse or minority communities, what have been some of those key barriers for their participation? We have alluded to some, but if, maybe some key ones or themes that have come up in your experiences.
Well, I could say we have some of the challenges we face in our area is, any type of literature that goes out, or information for services, for news, for updates, English and French, or French and English, it's very, we have to re-look at, all the people who may not speak French or English and can't read it, or don't know how to read. That's another thing. People who have a problem with reading in general. So that's probably one of the challenges we do have for sure, is we're trying to, as in different community organizations, develop brochures and pamphlets that will have the option of, 7 or 8 or 10 other languages and getting that information out to the areas that we know there's that population. And again, like I said, hoping that we can engage and encourage volunteers or employees to come forward if they speak other languages and share, help to connect with those people who may feel even more isolated because they don't understand, they can't read the information, they don't understand the language, they go to their same grocery store every week, they don't go out of the area because they don't know how to speak the language or read anything. So that's one of the challenges we have here.
Yeah, and I can add about the key barrier to engagement in compassionate communities. The main one in diversity or not, or minority or not, it's the taboo of death. It's big. It's a major barrier because when you talk about that, people usually leave. They don't want to stay and join the conversation. So what we found is that really the key success factor is to start with the needs of the communities. So you don't come to say, hey, we're gonna start a compassionate community, would you join us? It's not gonna work. So you have to have some workshop and ask people what is an example of a debt that they have in their works or in their lives within the past years and things like that. And people's gonna open up and start from their own experiences. And it's one way to overcome this kind of barrier. And I think it works well too with minority groups.
Great, thank you so much. For the sake of time, we'll take maybe 1 or 2 more questions. And the next question is directed to Kim and Amanda, and it's asked by Danielle. And the question is, have you measured caregiver burden and how this has helped or reduced the feeling of burden for caregivers?
Yeah, I think for this presentation, we were just focused on the one program, but we do have definitely some other things that have come out of this. So we just recently started offering a caregiver support group, which is held the last Tuesday of every month in conjunction with the Circle of Connection program. And so we have in the past, going back a few years, we did do a burden scale, a year at burden scale with our caregivers. And it did show improvement or a reduction in the feeling of burden with the program being consistent, somewhere they could take their loved one to, they knew they were safe and they could count on that respite each week, as well as building a support group as well, which is an opportunity for them to network, to support each other, to feel, again, that sense of belonging, right? That they're not alone. And so it has really had a positive impact in their life. Do you have anything to add?
And maybe we'll have time for one final one. We'll squeeze one in. And the last question we'll ask is, are there any standard measures used in the needs assessment and measuring impact of the programs? And I think this question applies for both of you, but I'll pass it over to Cynthia, just because you nodded. I'll pass it over to you if you feel comfortable. No, not yet. Okay.
No, I think it's a very complex question. Yes,
of course.
I'm smiling because it is everyone who is looking for impact, but you didn't start it. You didn't know who's going to be your partner, what program is going to be delivered, what's population. So I don't think at that point when you start, you have to follow the wave, and then when things get clearer, now you can choose an impact measure. But if we look at our project, maybe for the Circle of Connection is one program, so it aims to break social isolation. So you can take an impact measures tailored to that. But when it's a community-wide programs, that project with multiple program, multiple population to reach, the number one challenge is the impact measures. So you have to, I think we have to be more pragmatic about it and not thinking about, I'm going to measure it, because you can measure an impact and it's beautiful, but you have a dead or an angle mort, you don't see everything else that's blooming in the community, and then you can have much more impact. That what I know it's the funders who ask us to have impact measures, but sometimes it kills the intervention.
Thank you. And thank you to all speakers. For the sake of time, we'll ask for maybe your comments and for follow-up on the questions that we weren't able to answer today. But thank you all for having been with us. And we're excited to share that while today's session was the last in our current webinar series, we will be launching a new webinar series with the first session happening on September 25th, 2024 at 12 p.m. Eastern. And this new webinar series will be featuring speakers on a variety of different topics related to aging in place and experience from folks who are working in this area. The information to register for the next series is going to be available in the chat, as well as in the post-webinar email, and we really look forward to seeing you at these future sessions. So finally, your feedback is, of course, invaluable to us as we start to design these future sessions. And so we'd like to invite you to take a moment just to provide us with some feedback on today's session. So you would have seen a poll pop up. So please take a minute or two to answer those questions. And once again, thank you to our presenters for having been with us today and for sharing their experiences and their practices. Merci à tous et au revoir. Thank you, everyone, and goodbye.